Atia, she is a retired air marshal's wife. He has come alone. Her daughter is in Dubai. Just go back again. And she's so confident. She has lost her lung because of methotrexate. She has a lung fibrosis. Just see the confidence level. She's 82-year-old. She's not very happy with RR Hospital. He said that once you're retired, they don't take care of you well. So I'm just making a walk in my gallery just to say her, check her oxygenation level. And she is very smiley and good, but he's living with very low oxygenation state. His oxygenation is 83%. And this is basically an effect of rheumatoid arthritis. She's on methotrexate. Come here. Sit here, ma'am. Reason I am making a video so that I can share this video to your daughter in Dubai. So sit here. Now I made you walk. This is what you call a walk test. Normally we do it for 6 minutes. But I want to see how much you drop your oxygenation when you make you walk. So now you see, you started with 83, now you're 74. Now you see your oxygenation is 74. Now it's going dropping to 71. Now
old.
Again, do it. Check it once again. Take a deep breath. Couple of deep breaths. Take a deep sigh, breathe in and hold, and you will get a little more. Yeah. So let it pick up, because actually you have colored your nails. When you have little, next time when you come, one nail you should be off nail.
Yes.
Because otherwise this color code will not be, so it may not be reflective of the right oxygenation level.
Okay.
So this video
91.
So this may not be the right reflection. What I'm trying to say, look, though you've done well, I really appreciate your confidence. You have walked alone with your driver and all. And what you have to understand that when your rheumatoid arthritis can affect the lungs directly or through the drugs also.
Because of arthritis.
Arthritis can also have an
methotrexate.
One could be methotrexate. Another thing, rheumatoid arthritis itself can give you, because it's an autoimmune disease. The body, fights against that. So lung can also be a little reactive process of the whole disease. Now, what we have to see is that at your age you are done well. So I have to see to it that that your lungs, do well when you are doing active. The whole concept of lung fiber, because you have developed a little lung fibrosis. What happened? The small goblets of the lungs, what we call alveoli, they go into little shrinkage because of the autoimmune changes, and that causes you a lot of discomfort in the breath. So what you have to do, we have to make you functional. It's not that we have to give you drug for that. We'll give you some inhalers and all. What we want to do is a good pulmonary rehabilitation program where we'll skill you with certain breathing techniques. And also you have to have some oxygenation at home. This is called oxygen concentrator. Do you have one at home? Oxygen concentrator?
I've got nebulizer.
No, nebulizer. Nebulizer is basically to deliver drug, which is not.
No, I don't.
So I'll tell you, your ECHS will give you an oxygen concentrator. Let me recommend you for you. Mm-hmm. So basically oxygen, normally the oxygenation in the atmosphere is 21%, because normally we breathe about 25% of the air, which is oxygenation. But with the 21% of air which you're breathing in, that is not sufficient for you to, augment your oxygenation
because of a lot of pollution.
No, not pollution. The lungs have gone into a shrinkage. It is the lung lost its little luster. This is called interstitial fibrosis. The interstitium is the wall between the two, alveoli, or what you call the goblets of the lung. So we have to supplement your lung with some oxygenation extra. We'll give you certain drugs, and most importantly, I'll call my rehab team, my therapist here, who will skill you with certain techniques. These are called pulmonary rehabilitation. I'll call my secretary. She will connect you to my rehabilitation team. सुनो बेटे, वो रिहैब में से किसी को भेज दोगे नीचे से थेरेपी से? नहीं फिजियोथेरेपिस्ट. So I'll just connect to my team of physiotherapists here. They are basically they are skilled people to take care of the lungs. This is what we call the physiotherapy of the lungs, where what we do is that we skill you with more breath per breath. So like when lung goes into a little shrinkage, I'll show you how does a shrinkage looks like. If you see this photograph, you will come to know what exactly is lung shrinkage, what we call the lung fibrosis. So I'll show you. And you see here. So what happens when the lungs goes into shrinkage, your work of breathing increases.
Yeah,
So-
because I've not been walking.
So what happens, for the same work you have to push more air. To push more air, you have to take more breaths. So when you take more breaths, you get fatigue, and that gives you a lot of breathlessness. So what we have to tell you is now you see here, this is the picture. The lung has got this kind of tubes,
Yes.
These are called alveoli. This is like goblets, and every sac is an oxygenation sac.
Ji.
So when we breathe, it goes into this sac, and finally the body gets, because ultimately the life is oxygenation,
Yes.
and our food gets oxidized by this oxygenation which it comes. Now what happens here, you see on the other side, a lot of these goblets, or what you call alveoli, they're getting destroyed. There's a scarring which has happened.
Is it because of not walking?
No, is it because of methotrexate and partly because of rheumatoid arthritis? This is called interstitial lung disease. You see here, this is the normal lung we are showing. This is called alveoli, and these are the interstitial lung disease. So you have a significant amount of interstitial changes. Now, at your age, it's not progressive. You had some disease, it progressed a while, now it has got stuck.
No, it's got.
So I cannot revert this lung. But what I can do, I can really work on this lung to enhance your capacity of the oxygenation.
Ji.
So we have to work on this normal lung. On the dead lung or the interstitial lung or the fibrous lung, nothing can be done. But lot can be done. Suppose this lung is functioning, say 20-30%, I can make it do 40% with the skill techniques, and that is what we call pulmonary rehabilitation. So in nutshell, we'll give you some inhalation drugs. Nebulization is bad for you because nebulization is more drug, and that will also spoil your lung, because once you get more drug, no, absolutely no to nebulization. We'll give you through spacer technique. I'll tell you what is a spacer technique. Everything, I don't know who has given you nebulization.
Idhar hi diya hai. Upar.
Whatever. So I'll show you what is in how is this. How is this is. This is
Any sleeving?
you see this. This is the device you have to buy. This is called spacer
the
device.
Spacer, I have the
With the
spacer.
spacer, you have to take the drug so that you get minimal drugs.
Yeah, I've got that.
Yeah.
In Dubai, they had given me that.
Yeah,
I've
so
got that.
so that is what we will
I
be
did
giving you.
bring the-
And secondly, I'll skill you with certain techniques. So you have to buy 2 gadgets. This is called acapella. This is help you to breathe out better. If you breathe out better, you will breathe in more, because lung is like elastic tissue.
Yeah, if you breathe out,
So
then
this
I
will help you
breathe.
to breathe out better. This is called PEEP device. It creates some positive pressure in the lungs so that you can release your extra air which is getting trapped. This is called acapella device or PEEP device. The another thing which you have to, this is called spirometry, coach incentive
Oh,
spirometer.
that one you blew.
You have to blow in. So this is a breathing in techniques, and that is a breathing out techniques. So all those things my team will be explaining you. So in nutshell, 1, 2, 3, 4, we have to stop nebulizer, number 1. Number 2, we have to connect you with some home oxygenation therapy. It's not in cylinder, you plug in and oxygenation starts. It's called concentrator. It concentrates the atmospheric oxygen to up to 98%. So only thing is that there's a long pipe. Through pipe you can walk around, and in the night you should be taking more. Another thing which you have to really work is that you'll develop a little stooping.
Yes.
The reason being, when you're not able to breathe better, so lung goes into a little this posture, because that is a posture which gives you the maximum kind of oxygenation. So we have to take care of the stoop also. So for that we can give you some spine support, some jacket called Taylor's breast. That also we'll talk about it. So one thing is that we have to stop nebulization, we have to give you home oxygenation therapy, we have to skill you with certain breathing techniques which my team will do it, and also will put you some inhalation drugs through spacer. And also we will do some other evaluation once you do a little better. But these 2 things will remarkably enhance your capacity of the lungs, and you will breathe better, feel good, you will be much more functional. So this is what I've recorded for you and share with you through YouTube, and you can share it to your daughter. And basically, how you stay where? You said
Gulmohar Park.
Gulmohar Park.
Yes.
And who are there with you? Your husband?
My husband.
You and dear Gulmohar Park. So you are a retired.
My husband is retired.
So he was.
He is 86.
He's 86-year-old. So he is a air marshal.
Yeah.
And your daughter is in Dubai.
He was in
So how frequently you travel to Dubai?
Actually, I'm going to leave. I was expected to leave on the 8th.
So will you able to organize all this kind of things at home at Dubai? Probably your daughter can organize an oxygen concentrator there. So you have one here, one there.
She'll do that. That's when we go for 3 months in July.
So what I'll do, I'll
I'm
put
just
everything.
going
I'll
to-
make it a small video for it because there's a long video. We have to make it. We have to squeeze it through in YouTube and share the link with you. Your number already is saved. You forward it to your daughter. Okay. So this is what will go to you.